Hi, good afternoon, everyone. Yeah, so today my topic is on Ganoderma, how Ganoderma can help on diabetes mellitus. Yeah, so diabetes is a chronic disease that requires long-term management and has a high risk of complications. So today we'll talk about this topic. Next is the disclaimer. So as usual, we have a disclaimer, and all the information that we shared in the slide are actually intended for education purpose and not for health advice. So treatment or care. So this is a disclaimer. Okay, so on 13 April 2016, our then Singapore Health Minister declared war on diabetics. Yeah, in Parliament. So this is to raise the awareness, public awareness on the disease in an effort actually to reduce the burden of the diabetes in the population. So it is to specifically address the concern of diabetes. And the burden is not only to individual, but also to the overall healthcare system in Singapore. So as we are likely to actually need more healthcare facility to cater for the rising number of patients that have the disease resulted from diabetes. So later in the slide, we will actually look at what are the complications from diabetes. Next, please. Yeah. Diabetes. Yeah. Now we look at the endocrine system. Yeah, our body has a network of glands that actually produce hormones to regulate our body function. Hormone is our body's chemical messengers. So they actually travel in your bloodstream to tissue and organs. They actually control and regulate a number of functions such as growth and development, metabolism, sleep and mood, sexual and reproductive processes. Start from the head. We have hypothalamus, pituitary gland, pineal gland, thyroid gland, thymus, adrenal gland, pancreas, ovary for women, and testes for men. So for hypothalamus, this is the master controller gland that produces different types of releasing hormone to tell other glands to produce the type of hormone to be released. So those hormones will be traveling in the bloodstream to reach the distant organs. For example, hypothalamus actually related to growth hormone, pineal gland related to melatonin hormone, which actually help with your sleep. So pituitary gland is actually related to a hormone that control production of sex hormones, estrogen in women, and testosterone in men. As for pancreas, it's actually related to hormone that control the sugar, the glucose level in the blood, which is today's our topic on this. So, yeah, and yeah, endocrine disorder. Yeah. So endocrine disorder, this happens when the gland produces either too much or uncontrolled hormone, or sometimes too little or no hormone. So these two are related to imbalance of hormone in our body. So endocrine disorder can also happen when cells are faulty and resistant to the hormone. So the cell that I'm referring is to as the endocrine cell. So there are three types of endocrine cells: alpha cell, beta cell, and delta cell. So alpha cell, which actually secrete glucagon, actually to increase the glucose level in the blood. Yeah, when they detected our blood glucose level is low. And beta cell, which secrete insulin. So this is the cell that actually make insulin. when our blood glucose level rise. Yeah. So delta cell, which actually inhibit the secretion in the other way. Delta cell, which actually inhibit the secretion of glucagon and insulin. So it acts like a regulator of insulin and glucagon secretion. So next we look at the diabetes mellitus. Yeah. So chronic disease in which the level of what is diabetes? Actually, diabetes is a chronic disease in which the level of our blood sugar in the body is high over a period of time. Okay, why is it a chronic disease? It's because having too much sugar in the blood for a long period of time can cause serious health problem if it's not treated. Yeah, the high blood glucose is due to the breakdown in glucose metabolism, which means glucose stay in the blood and not able to enter the cell. So as we know that glucose is a vital source of energy needed by our body, such as muscle, tissue, and organs. So as glucose metabolism, it requires insulin. So without insulin, glucose cannot enter the cell. So insulin is a hormone, which is a messenger, which is produced by beta cell in the pancreas. Yeah. So next, we look at how insulin works. So insulin, our body cell need insulin to actually bring the glucose in the blood to the cell, so that they actually can convert the blood glucose for energy. So the food we eat consists of carbohydrate and sugar. They are actually digested in our stomach and converted into glucose, which is sugar in the blood. When pancreas detected a rise in the glucose level in the blood, it will actually release the hormone, okay, which is producing the so-called insulin. So insulin will actually then move the glucose into the muscle cell organs, and some of them will be actually stored in the liver. So glucose that's stored in the liver is in another form called glycogen. So this storage is actually will be used at the later stage when we need them. So when we are not eating and our body need the glucose, that's where glucose level in the blood is low, and the pancreas will actually produce another hormone called glucagon. So when that happens, the liver will release the stored glucose to be used as energy for the body cell. Yeah. So next, we look at types of diabetes. Yeah. So there are two types of diabetes, namely type 1 and type 2. First, we look at type 1 diabetes. So what is type 1 diabetes? Type 1 diabetes is no insulin is produced by the pancreas, meaning pancreas cannot produce any insulin. Yeah, the cause is unknown, but it is related to damaged beta cell in pancreas. This could be due to either a viral infection or autoimmune reaction. Yeah. So for type 1 diabetes usually happen during puberty or in young adults. Young adult as in 18 to 20 plus age. Yeah. So of all diabetic patients, about 5 to 10% are type 1 diabetics. So if our body is unable to produce enough of the hormone insulin in the pancreas, it will be require a daily insulin injection. Yeah. So this is classified as type 1 diabetics. Next, we look at type 2 diabetics. Yeah, for type 2 diabetes, is actually characterized by insulin resistance and possibly reduced insulin secretion. So what it means is that insulin resistance is a condition where the cell in the muscle, fats, and liver do not react to insulin and are unable to actually use the glucose from the bloodstream for energy. So to compensate this, the pancreas make more insulin. So when that happens, over a period of time, that lead to blood sugar level spike because they are not responding to the insulin that they produce by, yeah. So type 2 diabetes are primarily due to lifestyle factors, yeah, obesity, and BMI in general will be something like greater than 30, high waist to hip ratio, and lack of exercise, okay, inactive, and poor diet and stress. And such people typically have three highs because high blood pressure is twice as likely to strike a person with diabetes than a person without diabetes. Yeah. So this problem also tends to occur in adult over 40 years old. Yeah. So of all diabetic cases, about 90% are type 2, which means it's insulin resistant. And it is usually developed very slowly from pre-diabetic stage. Most of the time, it is often overlooked. Okay, so basically, type 1 diabetes is a genetic condition that often show up early in life. And for type 2, it's mainly lifestyle related and develop over a longer time. Yeah. So the next, we look at another type of diabetes, which is during pregnancy. They call it as gestational diabetes. So this happens when it's a condition. This gestational diabetes is a condition in which blood sugar level become high only during pregnancy. So this occurs when the body can't make enough insulin during pregnancy. So some women who don't already have diabetes may experience high blood sugar level only during pregnancy period. It affects about 3 to 10% of all pregnant women. So due to inadequate insulin secretion or reduced insulin sensitivity, so it is not enough insulin or become insulin resistant. Yeah. So there is a risk of delivery complication, and babies with low blood sugar grow deformities, etc. So because glucose is the main source of fuel for the brain and the body development. So after delivery or later in life, there is a risk of developing into type 2 diabetes. So this is about 5 to 10% of the pregnant women will have it. Yeah. Next, we look at the sign and symptom, complication and causes. Yeah. So for symptoms, actually, the first one is the frequent urination. Why? When you have excess glucose built up in your blood, your kidney actually are forced to work overtime to filter and absorb the excess sugar. Yeah. So the next is the increased thirst. So you feel thirsty very often. So when your kidney can't keep up and the excess glucose is excreted into your urine and dragging along the fluid from the tissue. So it makes you dehydrated. So this will usually leave you feeling thirsty. So as you drink more fluid to quench your thirst, you urinate even more. Yeah, that's why this is a cycle that go through. Yeah. So another one is another symptom is that you always feel hungry and you're hungry, you like to eat more, but you have weight loss. So because glucose from the blood are not able to enter the cell. Yeah. So due to either a lack of insulin or insulin resistance, so the body can't convert the food you eat into energy. So the lack of energy will cause you increase its hunger. Yeah. So for weight loss, it's because they can't get the energy from the glucose in the blood, and the body start burning fat and muscle for energy, so causing a reduction in overall body weight. Yeah. So The next symptom will be slow and poor healing of wounds. Yeah. So blurred vision, itchy skin. So why? Because poor healing and wound and elevated poor sugar level actually decreases the function of red blood cell that carry nutrient to the tissue. So this actually lower the efficiency of the white blood cell that actually fight the infection. So without sufficient nutrient and oxygen, wound heal. So wound heal actually very slowly. Yeah. Next symptom is the fatigue, tired, and lethargic. So because your body cell not able to get the energy from the glucose, but in actual fact there are sufficient sugar in the blood. Yeah. So because of diabetes actually damage the blood vessel and nerve. The complication can be cardiovascular disease, nerve, kidney, and eye damage, and sexual problem, and also reduced immune system. Why? Because hyperglycemia actually promote the production of destruction molecule in the body, which actually interfere your body natural defense mechanism. Yeah, so your immune system will be actually somehow affected. And lastly, you look at the causes. So the causes are lack of insulin secretion, whether genetic or from the drug, and uncontrolled diet. Okay, it's a lifestyle related, or obesity, lack of exercise, and stress related. Yeah. Next, we look at test and diagnosis. For test and diagnosis, we normally do a blood test actually with a device that actually click on this and do a check on that. So normally we do on two different times. One is a fasting blood sugar test, which is where we call overnight test, meaning empty stomach test before you eat the first meal. So the range normal will be less than 100 mg per dl, and pre-diabetic, okay, if you have this 100 to 125 mg per dl, this is pre-diabetic. Yeah. And if it's diabetic, which means the sugar content is higher, which is greater than 126 mg per dl. So the other one is a random blood sugar test. Will be after meal. Yeah, after meal, any time after meal, 2 hours or 3 hours. So if it's diabetic, the range is greater than 200 mg per dl. Yeah. So next we look at what are the medication for treatment. So the medicine is the hypoglycemic medicine. So there are different group of drugs that actually can help to lower the blood sugar. So the function of the drug is to actually lower the blood glucose level by either increasing the insulin sensitivity or glucose uptake by the muscle and fat cell. So on the left, for the first group, medication primarily used to treat type 2 diabetes mellitus. So they are actually able to lower blood glucose concentration, mainly for type 2 diabetes, because since tissue cell have trouble responding to insulin, so they are able to actually lower down by this. The most in addition, this medication inhibit the glucose production in the liver, because the liver also produce the glucose. So as a result, it ultimately lead to actually a decrease in blood glucose. Okay, next we look at the second group of drug. Okay, is to lower blood glucose by actually delaying the digestion and absorption of carbohydrate. Okay, third group, okay, on the is another group of drug that to increase the insulin secretion. So in summary, it all depends on the type of diabetes. The medication can help actually either to lower the glucose level in the blood, increase the insulin secretion, or move more glucose leave from the blood into tissue. So when that happens, glucose in the blood can actually be restored to a healthy level. Yeah, but look at how insulin drug work. It actually works by providing the hormone, okay, to your body, actually that replace the insulin that being produced by the body. Yeah. So in summary, so for type 1 diabetes, okay, the patient, we have no choice, okay, because of pancreas not able to produce a good insulin, okay, or enough insulin, so you have to go for insulin injection. As for type 2 diabetes, you have the option to take all this medication, okay, first. But if this medication cannot work, then another option will be to inject the insulin. As your body produce insulin, it's not working also. So you have to actually get the insulin from external by injection. Yeah. So next we look at the possible side effect from all these medication. Yeah. So first one is a hypoglycemia. Hypo means lower glycemia. Hypoglycemia means lower blood sugar. So when that happens, it means our body had lower or not enough blood sugar. It could be due to too much insulin in the blood. As the level of sugar in the blood drops too low, you may actually experience blur vision, feeling sleepy or weak, etc. So another side effect can be your stomach discomfort. So because the drug has a delaying effect of emptying the food from stomach. So this one related to the group of drug that actually have this effect. And third, another side effect is a weight gain. So because of the lower blood sugar that lead to an increase in appetite. The weight increase also because of the excess insulin that are trying to convert the dietary sugar and fat into your stored body fat. So in fact, what the drug does is by affecting your body's insulin level and how your body use the sugar. Yeah. So the fourth one is a fourth side effect could be swelling of leg and ankles. So this one is water retention. So when you have excess insulin, you actually rise to an unhealthy level. You actually make you raise the cholesterol production to an unhealthy level, and it actually make kidney retain sodium, causing water retention. So actually, insulin is also act as another type of hormone that actually raise the cholesterol level. Yeah. So insulin also is an adipogenic hormone. Yeah. So this one will actually cause the circulating of fatty acid and enhance the triglyceride synthesis. That's why cholesterol production is rise to an unhealthy level, and that lead to so-called kidney retain the water. Yeah. Next, last one would be the skin rashes. Yeah. So next we look at the prevention of diabetes. So what are the prevention? Especially for type 2 diabetes. So the first one will be healthy diet as usual. Take more fiber and less carbohydrate and fats, and choose low or medium glycemic low GI carbohydrate. Example, sweet potato. Medium GI would be brown rice, and millet would be low GI. Yeah. Why take more fiber? It's because fiber does not raise glucose level, as fiber is not digested by the body. So fiber is a structural portion of fruits, vegetable, grains, nuts, and that cannot be digested or absorbed by our body. Yeah. Second is to maintain normal body weight. So BMI, try to stay below 25. Yeah. So it related to so-called be physical active, so we can maintain your body weight and as well as the BMI. So because your muscle use up some of your excess blood sugar, which help you to actually lose weight. That's why you can actually lower or maintain your BMI, and we can effectively use the insulin in your body. Yeah. So the fourth one will be maintain healthy lifestyle. So reduce smoking if you are a smoker, and stress management, and have sufficient rest, because it can actually help you control your blood sugar. Okay, manage your weight and control heart disease. All these are risk factors, such as high blood pressure, high blood fat. So these are actually quite a high risk factor. So we need to manage that. So the fifth one is the TCM. In TCM perspective, diabetes actually is from spleen. Yeah. So TCM organ actually believe that for TCM, they believe that eat more yellow food, example white Lingzhi beef pollen, okay, soya protein, yellow food such as corn, banana, yeah, and capsicums, etc. Next, yeah, we look at the supplement, Ganoderma, Lingzhi, yeah. So Ganoderma, also known as Lingzhi, is a very special type of mushroom that has the healing property. So it has been recognized as a medicinal mushroom for over 2,000 years, and its powerful effect have been documented in the two oldest medical books in ancient China. So in the last 50 years of modern scientific research in Lingzhi, we can find many evidence-based reports published. So when you do a Google search, you can actually find keyword Lingzhi or Ganoderma and diseases. You can easily get more than 1,000 results show the research paper published. So all the report can be found in the PubMed website, which is the US National Library of Medicine. Yeah. Next, we look at what are the stronghold product. So when it comes to selecting Lingzhi product, you will be spoiled for choice in the market. So why would you choose Stronghold? Yeah, first, Stronghold is one of the world leaders in producing top quality Lingzhi. Their main core business is in researching, producing, and marketing Lingzhi. Yeah, the company has been in the business for 32 years. They are specialized in producing top-graded Lingzhi product. Head office is in China and the name as Endocrine. In this Southeast Asia region, it named as Stronghold. So the company owns their in-house R&D in Taiwan. They have a Lingzhi farm as well as the their own distribution network. So throughout many years of research effort with its patented extraction process, all Lingzhi products are extracted with two unique components, catechinoid and micromolecular polysaccharide content. Yeah, and the product have been scientifically certified with various endorsements such as TQF, HALA, certified as well as ISO. Yeah. Next, we will look at what the function and benefit. Yeah. So Ganoderma on diabetic prevention. So we look at the function and benefit. So the first one is the regulate immune system. So increase immune response for diabetes patients who are more susceptible to get infection. So when the infection gets worse and not able to control, the end result would be loss of limb. Yeah. So with immune system being regulated, it actually can prevent the autoimmune response from attacking the insulin producing cell, which is beta cell in the pancreas. So far, Lingzhi is quite unique that it can actually regulate the immune system because of the component catechinoid and micromolecule polysaccharide. Yeah. The second function of Lingzhi is improve blood circulation. So what it does is that it actually able to remove blood fat. Okay. and cholesterol, triglyceride. Once those fats are clear, thereby increasing vascular elasticity. So this will actually help to prevent risk of stroke. So when blood circulation is improved, we can actually prevent nerve, kidney, and eye damage, as all the cells can get their required nutrient and oxygen. So with good blood circulation, the waste product and the toxin can also be removed via the kidney and liver. Yeah. Next, the third, function and benefit will be enhanced liver function, which is detoxification. So this is able to eliminate toxin from the liver. Yeah. So with the improved blood circulation, all the toxin and waste product can actually eliminate, from the liver, and Lingzhi is also able to protect, another detoxification organ, which is kidney. Yeah. The fourth function and benefit would be the remove free radical and anti-oxidation. Yeah. So Lingzhi is able to protect and prolong the cell life. Yeah. So because free radical and the pancreas beta cell, and the pancreas beta cell will not be actually damaged once you are able to actually have the free radical and anti-oxidation effect from Lingzhi. Yeah, we are able to protect and prolong the cell life. So that actually help to and protect the so-called beta cell in the pancreas. Yeah, and hence the cell renewal. Yeah. So next, we look at the research. Next is the research on Lingzhi and diabetes. So this is the study that is to find out, can Ganoderma help in diabetes prevention. So this is done by Professor Lingzhi of Beijing Medical University. He published a report. So he did an experiment with two groups of mice. One is control, and the other group is fed with only Ganoderma, polysaccharide. They call GIPS. There are two groups of mice. So the one that fed with the so-called Ganoderma is with a dosage of 50 milligram per kilogram. So they feed this group of mice for 10 consecutive days. So after that, they actually administered a chemical to actually try to stimulate diabetes in these two groups. Yeah. Next. So the result came back is that all in the control group, which is without the Ganoderma injection one, so those groups became diabetic, but which means that their blood glucose, which means that they found that their blood glucose is much higher and their insulin is low. And for the treated group, they showed significant lower blood glucose and higher insulin level. So the conclusion is that Ganoderma, which is GIPS, the polysaccharide, is effective in preventing attack of diabetes and can actually maintain high insulin level and low blood glucose. Yeah. So Ganoderma has the potential to prevent. So from the experiment, they found that it actually can prevent diabetes. So next. So continue from the same research, the researcher found another interesting observation on the pancreas. Yeah. So also done by the same professor, Lingzhi. Now he actually examined the pancreas of the mice. So the result came back is that the pancreas of the control group, which means without the Ganoderma injection, were actually severely damaged, and the beta cell were all dead, while damage to the while another group, they found that the damage is to the beta cell were actually relatively low. as compared to the control group. Yeah, so the beta cell was still alive for the group that actually fed with the Ganoderma. Yeah, they found that the beta cell in the pancreas are still alive, and not the damage to the group, the damage to the so-called beta cell in the pancreas on the treated group are relatively low. So the conclusion is that he draw a conclusion from that, from the observation, is that the Ganoderma, the polysaccharide, can actually protect the pancreas and prolong the lifespan of beta cell. So actually is related to eliminating free radical, and thus actually can help to prevent diabetes. In the research, they also actually have this so-called 3,005 milligram dosage actually injected to them. Is actually equivalent to 62 capsule of YK Lingzhi. So 62 capsule of YK Lingzhi is actually referring to the calculation is based on polysaccharide. Yeah. So this is a 3,005 milligram dosage actually is actually injected to in the experiment they use for the mice. Then, so next. So this is another research that actually look at how Ganoderma can help in modulating the blood glucose. So this is done in November 87. A Japanese researcher Kimura actually published a report on hypoglycemic effect. So the experiment, they actually fed the mice with a high dose of glucose and causing almost glucose toxic, and then feed them with Ganoderma hot water extract. Actually, Ganoderma hot water extract are referring to the polysaccharide content. So this is a so-called glucose tolerance test. Next. The result came back is that after 10 minutes, after 10 minutes, the high blood glucose and insulin level actually decreased, significantly. And after 30 to 60 minutes, the blood glucose level remained unchanged, but insulin level increased significantly. So what it means from the conclusion is that Ganoderma polysaccharide are effective in reducing the excessive blood glucose, and thus also help to control the disorder in the blood glucose metabolism. So next we look at another research paper. So this is another research on also polysaccharide, Ganoderma polysaccharide. This is look at to decrease the postprandial blood glucose. So postprandial blood glucose is the amount of sugar in your blood after you eat something, after you eat the food, okay, meaning after food, blood sugar. So in 2000, so this research done in 2000, clinic. Now this one is in clinical trial, okay, conducted in Taiwan. So it involved 46 patients. They divided into two groups, okay, and the patient have a history. Those patients have a history of 6 to 10 years of a medical history in diabetes, and it's a double-blind test. So these two groups, they do not know which one that they are taking, whether is it in with Ganoderma or not. So it's a double-blind test. So after 12 weeks, the treated group, meaning those fed with the Ganoderma polysaccharide, show a decrease in their so-called after-meal blood glucose, whereas the no significant difference were observed in the fasting blood glucose. Fasting blood glucose is before food. So they see a difference. So what it means that they in this experiment, they don't see a significant difference in the fasting blood glucose. But for the two group, they actually see those the blood glucose after meal, they see a difference. Okay, they see that the treated group had actually show a better result of the lower blood glucose for the treated group. Yeah. So for both group, the fasting blood glucose, they don't see a difference. Yeah. This is what it means. Okay. So in conclusion, they found that next. In conclusion, they found that actually Ganoderma polysaccharide can actually reduce postprandial range after food blood glucose level, and which Western medication normally find difficult to control. Yeah. So medication are usually for reducing the fasting blood glucose. Okay. So significant of a long-lasting high postprandial blood glucose can actually damage our organ. Yes. So Ganoderma can actually therefore be an effective supplement treatment for diabetes. So in summary is that Ganoderma polysaccharide can actually effectively reduce the postprandial blood glucose level. Yeah. Yes. Next. So another research is actually done to see how Ganoderma can improve in the blood flow, circulation, antioxidation, and eliminate toxin from the liver. Yeah, so this is the research. They actually found that they can actually help by removing the blood fat, cholesterol, triglyceride. So with that, they actually increase the vascular elasticity and risk of stroke. Yeah. So another one is antioxidation and eliminate free radical. So when you have free radical being able to remove, you actually protect your beta cell in pancreas. And when your blood circulation is improved, right? The Ganoderma also can help in enhance the liver function. So when blood circulation is improved, your liver function is working, and all this work together, you actually can eliminate toxin from the liver more effectively, and also able to protect other organs such as kidney. Yeah. Next. Next, we look at the dosage and vertical reaction. Yeah. So this is a recommended Ganoderma dosage. For prevention is 4 to 8 capsule of YK Ganoderma. And for therapeutic pre-illness level, you can actually take up to 12 capsule and above of YK Ganoderma and above. Yeah. Or 20 capsule of YK Ganoderma and above if there's autoimmune related illnesses. Yeah. Third, therapeutic and mega dose. This is a higher dose. Okay. And 30 capsule of YK Ganoderma above. And this one more related to those patients that involve many other complications. You can actually take up to 30 capsules. So vertical reaction is all depend on individual, and some slight increase in blood glucose, and occasionally or some of them may actually experience some swelling on hand and leg. But these are the reaction, no cause of concern because it's just temporary. Yeah. And we'll look at other stronghold product. What we have YK Poland is it's good to actually consider as a supplement. Yeah, and because it's a complete nutrition for diabetes to supplement restricted diet, rich in vitamin B6. Next is a Jaho fiber. So actually, Jaho fiber is able to actually reduce your high blood glucose and also fat level. Third one is a Jaho instant soya protein powder. So soya protein powder, this is easily absorbed and prevent fat build-up and promote rapid wound healing. Yeah. So fourth one will be for the eye. It's a YKI plus. So this one had a powerful antioxidant, actually antioxidant and needed for organ with a blood capillary. The last one will be the CEO coffee. It contains antioxidant that actually may slow and release of glucose into the bloodstream. Yeah. So next we look at testimonial. So this is a testimonial from Taiwan. Mr. Lin, age 28, back in 2008. He had a this one is a type 1 diabetes testimonial. So Mr. Lin went for medical checkup after his mother discovered there's a bubble in his urine in the toilet bowl. So he also noticed that a few weeks prior to the checkup, he always felt very tired and sleepy, and also become very thirsty for no reason. So he was after checkup, he was actually diagnosed with type 1 diabetes, and the report shown the glucose level is very high at 501 mg per dl, which is equivalent to 28 mmol per liter. So normal range is about 100 mg mdl. So his is 5 times higher than the normal. So his high glucose condition became worse and became so-called another condition called DKA, which actually this one can be a life-threatening to a patient. So this happens when your body doesn't have enough insulin to allow the blood sugar into your cell. Yeah. So this is way because our sugar is too high. You have too little insulin to actually move the blood sugar to cell. So he was immediately hospitalized, and required immediately insulin injection, and then it's a continuous within a day, few times a day. So he started, okay, at that time on the first day he already started. Second day he started taking Lingzhi and bipolar. 5 capsule, okay, each for Lingzhi and bipolar, each every hour. Okay, his condition improved second days later as the fasting sugar level dropped. Okay, so all this come together with the insulin, with the Lingzhi, with the bipolar, all work together, and his condition improved. Okay, and start to drop to 200 mg, which is good. On the third day, he also see improvement. His glucose level dropped even further to 140 mg per dl. This is the level where the hospital can actually discharge him if he dropped to this level. So on the third day, on the fourth day, he actually discharged. So since his condition has improved, okay, when he back home, start to see improvement. Okay, he continued the same dosage. Okay, since his condition had improved, he actually reduced the Lingzhi and bipolar dosage to 8 capsules each for 3 times a day. As for the Western medication, he will need to inject, okay, continue to inject 20 cc of insulin daily. So all work together with the Western insulin. Yeah. So after 2 weeks, he went for a medical review, and report came back is that the glucose level dropped even further. And also they also observe other tests, okay, in the report. Okay, they also found that the result came back is also show significant improvement. Example in the triglyceride and cholesterol level. So with his good progress, actually doctor at that time also allowed him to decide as and when he see fit to reduce the insulin dosage. Yeah. So you know that he is progressing well for such a period of time. So after 3 months of insulin injection, okay, his glucose level returned back to a normal and in a healthy range. So he himself decided to stop, since doctor already give instruction that he can actually stop as he see fit. So he decided to stop the insulin. So he just take the so-called Lingzhi. As for Lingzhi, he continued but now with a reduced dosage of 12 capsules per day. So in summary, okay, and his condition improved for them. Yeah, since already back to normal. So without the insulin, already back to normal. So just with the Lingzhi. So in summary, not only his fasting glucose dropped, okay, to 81 mg, and his HbA1c also maintained at a very healthy level at 5.5%. Yeah, so all this had significant improve. So he also see other tests improving, such as triglyceride, cholesterol also improve. But to his surprise, okay, his uric acid also dropped to 6.4. Previously, he had a very high uric acid at 9.4 mg per dl. Yep. So next we look at his testimonial. So this is the so-called the report that he documented, yeah, from different dates. Okay, now we look at other testimonial. So these are some of the other testimonial also on so-called Ganoderma. They use Ganoderma, okay, and for all the diabetic patients. So the first one is Madam Sun. Yeah. So Madam Sun, yeah. So 80 years old, and she had type 2 diabetes. Took 4 Lingzhi for 4 times a day, and they don't have any reaction. So after a month, fasting glucose dropped, okay, half. Okay. Before that, it was quite high. Then it dropped half, and she also had the so-called open wound before taking insulin. She had an open wound, okay, and heal very slowly. So after taking, actually started to heal at a faster rate, and her blood pressure also improved, okay, also back to normal. Yeah. So the next testimony is Mr. Chan, also 82 years old, having stroke and fasting glucose very high, also 250 mg, and took 5 to 6 capsules every hour, total about 60 capsules per day. And the only reaction he had is black stool, and he also had a second stroke as he reduced the dose of Lingzhi. But as he started Lingzhi again, and maintained at 6 to 7 capsules daily, and also double the dose of the capsule for P pollen, and so far no other complication of diabetes, and I've been taking for 20 years. Yeah. So the last testimonial will be Madam Chang, at 60-year-old. All these testimonials are from Taiwan. So 1.5 years ago, having diabetes. Yeah. So after his so-called glucose level also very high, 364, and I have hypertension. Yeah. So he maintained taking Lingzhi, maintained at 3 to 4 capsules, and at times he actually increased to 5 to 6 capsules when not feeling well. And blood glucose and blood pressure, when initially when started with Lingzhi, actually her blood glucose and pressure actually went up, okay, for a while initially. Yeah. So she has been taking more than a year. So far now his blood glucose level is more or less stable at 120. Now she can actually more relax on diet now. Yeah. So these are the testimonial actually can be found on the Ganoderma magazine issue 39. Yeah. So next is we come to a conclusion. Yeah, the conclusion is that diabetes is the lifelong disease that actually has no cure. Only through lifestyle and diet that we actually can keep up under control. And medication is only address the symptom and not the root cause. So Songho has a series of so-called safe and effective health products. Ganoderma, example, Ganoderma to assist you on this recovery journey. And prevention is better than cure. So in summary, diabetes is a disease in which prevention is more important than treatment. Yeah, with that, I end my presentation. Thank you.